Let's start chapter bacteriology. First, we have all the cocci. So all the cocci are gram positive except three, which are venom. So VE means Veillonella, okay, and then N means Neisseria, M means Moraxella, okay. So these all were the gram negative cocci. Otherwise, all are gram positive. Now come bacilli. Bacilli all are gram negative except a mnemonic called McDonald's. That means Mac means Mycobacterium, M means Mycobacterium, A means Anthracis bacillus, C is Clostridium species. So let's all these three in this Anthrax and Clostridium. They both are spore forming. Then we have C. C is Corynebacterium diphtheria, and then we have diphtherioid. Okay, then we have Na. Na means Nocardia actinomyces. Nocardia and actinomyces, these are gram positive filamentous. Then we have Listeria, right? So what do we have here is we have gram positive cocci, in which we have Micrococci family. In this we have Micrococcus and Staphylococcus. So in Staphylococcus, what do we have is bunch of grapes, fermentative, okay, fermentative then negative, and then it will be catalase will be positive, right? Then we have to see the Staphylococcus aureus, right? So in the Staphylococcus aureus, we have to see the virulence factor. So what do we have is protein A is anti-complementary, anti-phagocytic agglutination. Then we have enzymes means Staphylococcus. This is the only mnemonic. So S is different. T means thermonuclease. PHY means phosphate. Okay. Then comes Staphylococcus C. Double C means catalase and coagulase. Then we have toxins. It's important. We have four toxins: hemolysins, okay, PVT. Then we have epidermolytic, and then we have enterotoxin F. Okay. So in hemolysis we have alpha, beta, gamma, and delta. Okay. So then in this, what do we have is we have beta hemolysin. This is also called as sphingomyelinase, and sphingomyelinase is also called as hot cold phenomena. Okay. Then we have PVT, penton valentine toxin. In this we have synergohymenotrophic. Okay, in this we will action between the two, PV toxin and this toxin. Okay, so in this, then what do we have is alpha, beta, gamma. Then we have is PV toxin and gamma hemolysin. So these are the two, and then we have epidermolytic, in which we have 4S, SSSS, that will be of child Reiter syndrome, and then we have 10, TEN. Okay. Now we have enterotoxin F. This is very important. In this enterotoxin, see, usually we have A to I. Okay. In A to I, in this there will be no F. There will be food poisoning. If it is less than that will be incubation period will be less than 6 hours. So in this there will be Staph aureus and beta cereus. In Staph aureus it will be meat milk, and in this there will be pastry and mayo. Then we have cereus. Cereus means Chinese food. Chinese will be vagomimetic, right? Then we have enterotoxin F. F means it will be female fetal. In this there will be TSS, toxic shock syndrome. Then in this there will be cause, that will be like history of prolonged tampon use. Okay. Then we have enterotoxins. Okay, which I told usually A to F. Okay, and then we let's see the clinical features of Staphylococcus aureus. Okay, in this mnemonics is soft pains. Okay, soft means skin and soft tissue, and in this there will be botryomycosis, which is a bunch of grapes. Okay, and then O means osteomyelitis, that will be Staphylococcus aureus. F means food poisoning, incubation less than 6 hours. Then we have T means TSS, toxic shock syndrome. Okay, and then we have P. P is pneumonia. So pneumonia will be hospital acquired pneumonia or ventilator acquired pneumonia, right? And then we can have next P also pneumatococcus. Then we have A. PA in soft pains, right? So A is acute infective endocarditis, that will be there. And then we have INS, infective arthritis, necrotizing, and sepsis, right? Now main things are how do we diagnose it. In Staph aureus, it is gram positive cocci, right? So it's gram positive cocci. So in this there will be grape clusters, and in this there will be agar called nutrient agar. In this there will be beta carotene, staphyloxanthin. Okay, in this there will be golden pigment, which will be non-diffusible. Okay. Then we have MRSA infection. We have washing hands before and after treating the patient. MRSA infection, and we have a child which can be like sore throat, and 3 days of infection, that will be what? Blood agar. Medium will be blood agar, right? Okay. So now MSA I told. Okay. In this it will be like there could be differential media also. There could be selective media. Okay. Then it also changes the color. Phenol red indicator, right? So we can see these things. Now let's see the test. We have catalase positive test. So we have space being made, bubbly cats. So this is the mnemonic. Space being made in this, it will be like uh, S. S means Staphylococcus aureus. Aureus, it will be of a golden color. Then we have again S, that will be Serratia. So two R are there, so that's why it will be red color. Okay. Then we have PACE, okay, PACE, okay. So P means Pseudomonas, that will be blue green color, okay. A, and then C is Candida, okay. And in the E we can have is Escherichia coli, we can have Enterobacteriaceae family, okay. Being means B is Bacillus anthrax, then we have ING, okay. So N is the important, which is Neisseria meningitis, okay. Neisseria, and then what we have is made. Made means MTB and micrococcus. So all these things will be there. Then we have coagulase test, right? In coagulase test, we have slide coagulase and tube coagulase. In the slide, we have bound coagulase, and in tube we have free FREE coagulase, right? So what do we have in slide? We can have clumping factor, clump, which is bound, and in tube coagulase we can have free coagulase. Okay, that will be coagulase reacting factor CRF, right? Then what do we have is penicillin or beta lactam. Then what's the mechanism of beta lactam? That will be PBP. Okay. And then we have mechanism. Okay, let's see the resistance. In the resistance, it will be blastomere production BLA gene, and in this it will be transduction. So duction is more than, because it will be transfer. So that's why in resistance there will be transduction is more than conjugation, right? And then we can see methylene resistance, oxaline, all these things we can see. And yes, in this we can see the resistance also. For example, it could be vancomycin resistance. The vancomycin also called as daptomycin. In this, it will be Visa and VRSA. Visa is intermediate, R means resistance, right? So this was all about Staphylococcus. Now let's talk about Streptococci. Okay. In this, first of all, before that also, what we can know is coagulase negative Staphylococcus. Till now we were talking about positive. Now let's talk about negative. In negative we have two, epidermitis and Staph epidermis and Staph saprophyticus. In epidermitis it is more common. It is protective heart valve endocarditis. This question has come. Okay. And in this there will be biofilm production. And saprophyticus, it is less common. In this there will be UTI, right? Now comes Streptococci family. In this it will be green. Okay. And also in this there will be three, alpha, beta, and gamma. Okay, alpha is green color, okay, and beta is yellow color, and gamma means no hemolysis. Okay, so in alpha it is viridans pneumoniae, okay, and beta it will be pyrogens agalacti, that is hot cold phenomena, and gamma means gamma, right? So whenever we have fever, gamma gram positive cocci, vancomycin remains positive after 2 weeks. In that case, it will be Enterococcus faecium, that will be resistant to vancomycin, right? So now let's talk about beta 1. So in that, what is beta? Beta streptococci, it will be Lancefield classification. In this, it will be based on C antigen, right? Beta, it's beta hemolytic, but it is based on C antigen. It is class 5A2, class A. Okay, in this there will be no I and no J. Class A to V, right? Then what do we have is group A beta hemolytic streptococci, that will be S pyrogens. Group B will be A galacti. Okay, in pyrogens it will be like PSGN and RSD. Okay, in A galacti it will be Chem positive, means gala time in CMP, right? Then group A, it can be further subdivided Griffith and EMM typing, right? Now comes Streptococcus pyogenes. Okay, this is important. In pyrogens, it will be like gas, beta hemolytic. Okay, it can have virulence factor DNase A, B, C, D. Okay, B is the one which is most common. So in this there will be DNase B, anti-DNase B, that we use for pyoderma and PSGN, which I told, right? Then we have toxins. We can have super antigen, that will be streptococcal pyrogenic enterotoxin, which is SPE. Okay, in this it will be scarlet fever and toxic shock syndrome. Okay, in the streptococcus pyogenes. Okay, then what do we have is we have features in anti-streptolysin antibody testing. We have two things, streptolysin O and streptolysin S. In O means it is an antigenic property. Okay, and this will be liable. Okay, and in this serum means stable, oxygen means liable. Okay, so SLO. Okay, and it will be antianic and deeper. Whenever it's S means stable, S means soluble, non-antianic, like this. So you have to remember only antian O. O means SLO, S means stable, and L means liable, O means O antian, right? Then you have suppurative necrotizing signs we have. So that in that it will be mnemonic can be nipples, but we remember necrotizing fasciitis as important. Okay, and whenever it's non-suppurative, in this there will be rheumatic heart disease, PSGN. Okay, and you can have pandas, that will be neuropsychiatric disorder. Then comes a question about, for example, there is a patient clinical feature of pharyngitis which is associated with S pyogenes. Okay, in that case what it will be there, it will be pain. Okay, tender cervical lymphadenopathy, and there will be no cough. So whenever there will be no cough, that means it is penicillin. Okay, now comes group A beta hemolysis. In this it will be group A beta. So in this what we can see here is strepto, which will have changed, then streptopio. So pi means pi y pi. Pi means pinpoint colonies, y means wide zone, and rest pi will be Pike's media, right? And then we can see the selective media. In this it will be Saiba. Okay, that will be crystal violet blood agar. All these things can be there. Okay, then we can have PYR test and basic trans sensitive treatment can be penicillin. So this was all about group A. So let me give you one summary. Whenever you will have camp test, okay, for diagnosis of, it will be then streptococcus A galacti. Camp test means A galacti. Okay, whenever you will have reverse camp test, that will be perfringens. Okay, whenever you have cat set met, cat means cold agglutination test, then it will be mycoplasma. So remember, like cat set met, my by lie. Okay, cat means my means mycoplasma, set means standard agglutination test, my by, then it will be brucellera, then comes met microscopic, then it will be leptospira. Okay, so these are the things. Then let's come to streptococcus B. In B it will be like what I told was A galacti, chem test will be there. Okay, and in this there will be arrowhead, chem test will be there, chem test positive in streptococcus A galacti, which will be group B. And in this it will be like chem test positive, and also hippurate hydrolysis positive. In this there will be 3 diseases: meningitis, pneumonia, septicemia. Okay, pneumonia it will be hip. And whenever you will have alpha hemolytic streptococci, in alpha hemolytic it will be like streptococcus viridans and streptococcus uh, pneumonia. Okay, so viridans means no to all. Viridans always say, "Yaar, I am vir, I am vir, I will say no to all." So that person will say no to all, and pneumonia means yes to all. Pneumonia is the lens shape, and viridae means chain shape. Okay, so viridae means it will be non-soluble. Okay, it will be resistance to opoxin, and it will not be seen in inulin. Okay, but rest, if you see, second one will be pneumonia. In this it will be soluble, sensitive, everything will be there, right? So in viridans also it will be like endocardiaceae, and change will be there, right? Then comes in viridans also, then we have 4 things like mites, S mutans, sanguine, salvaris. So in mutants dental caries will be there. This question has already come. And also in pneumonia there will be carum coin colonies. Okay, and then comes dental caries. Then we have sanguinis, means endocarditis, and also whenever it's salivarius, that means capsule and saline layer, right? Now whenever we talk about streptococcus pneumoniae, which is pneumococcus, in this it will be like violence is due to polysaccharide capsule, right? So whenever you have polysaccharide capsule, in this it will be more than 90 serotypes. You have quelling reaction. Okay, that will be anti-serum to capsule, that will be swelling. Okay, so you will have capsule. In this there will be agglutination, swelling will be there, that will form carum coin colonies, that will be pneumonia, right? Then you can have some more feature also: meningitis, otitis media, sinusitis. Okay, and in this there will be carum coin colonies. Then you can have drought maced colonies also. The same treatment will be beta lactam or penicillin. Okay, usually in all it will be there, beta lactam penicillin. In some it will not be there, so that will be told. Okay, then is pneumovax, that is 23 valent PPV. Then you have Prevnar, that will be 13 valent. So pneumo means it's more, so that's why it will be 23, right? Okay. Then comes alpha, beta, gamma. Gamma hemolytic streptococci, that will be also called it's enterococcus. In this will be mnemonic will be ENT usually. Okay, so enterococcus there, so ENT, and take US of at the end one, right? E means streptococcal shape. N means non-motile, non-sporing. NaCl is there. T means heat tolerance. Tolerate, if tolerate also in 40%. Then US is UTI and septicemia. Treatment is penicillin, vancomycin, linezolid. Okay. So these are the things. Now the thing is, all capsules are made up of polysaccharide, except beta anthracis, which is made up of polypeptide. 2P will be there in the anthrax, otherwise all capsule are made up of polysaccharide, right? Then we have gram-negative cocci. So what is there in gram-negative cocci? So in gram-negative cocci, what I told was usually we have our three: venom, Veillonella, Neisseria, Moraxilla. So now we will talk about, we have venom. So first we will talk about Neisseria, right? So in Neisseria, what do we have here is two, either it's meningitis or gonorrhea, right? Whenever it's meningitis means take M means maltose, G means glucose, okay? And in gonorrhea means only one G is there, that means glucose, right? So now it will be nasopharynx meningitis, okay? And meningitis will be lens shaped, capsule shaped, right? It will be positive, catalase positive, oxidase positive, okay? It will be strict arrow. In this virulence factor can be A, B, C, Y, W135. All these things will be there, okay? And in this it will be like high grade fever, okay? Purpuric rash, gram negative diplococci. So all these things will be there, okay? Now let's talk about gonorrhea. Gonorrhea, where it will be? It will be in the genitals, okay? All G will be there: genitals, gonorrhea, glucose. This will be kidney shape, okay? Sorry. Then in catalase oxidase also it will be positive. It's both the same. Now oxygen requirement, here it will be facultative, there it was strict, okay? Now there is protein. In protein, see there it was what? A, B, C, Y, W135. Here it will be protein 1 and protein 2. Pore B 1A, pore B 1B. So pore B 1A means A lot, okay? And also in this 1B, yeah, these two things will be there. Then just you all know, I am just repeating. Whenever it comes Ducrey, Haemophilus ducrey, that means it will be chancroid, right? So if we go more, then we will see some of the things which are common in both of them, meningitis and gonorrhea. Like Ames test will be there, Thayer-Martin test will be there, ceftriaxone will be there. So these all things are there which are same, right, between meningitis and gonorrhea. Now regarding meningitis, some more features you can see, like pyogenic. This name you must have heard, Waterhouse-Fridges syndrome. This can be there. And in gonorrhea, some things you can heard like urethritis, ophthalmia neonatal, okay, cervicitis in female, okay. And also this word you can hear, Pitt-Hugh-Curtis syndrome, okay. So all these things you can see and you can heard. Now let's talk about the vaccine which is called as which is PYQ also, meningococcal vaccine. In this it will protect again A, C, Y and W135, because in this there will be no B, because in meningitis there was B, but here it will be no B, and because it does not protect against B, right? So this was all about the meningococcal. Now let's talk about Moraxilla catarrhalis. This is what? This is just a otitis media. COPD exacerbations are there. In this, first there will be most common and second most common. Most common is Haemophilus influenza. Second most common is Moraxilla catarrhalis. Okay, in this there will be hockey puck sign. Okay. Now we have talked this. Now let's talk about diphtheria. So this is one of the important topic. Okay. This is gram-positive bacilli. Okay. So in the gram-positive bacilli, what do we have is we can have like Bacillus anthracis and anthrax, right? So what is there? It's first of all it's dependent on iron level, okay. In this we will have toxin, okay, that will be acidic formation and that will lead to toxoid vaccine, okay. So now let's know about toxins which decrease protein synthesis. So there are some toxins which are decreasing the protein synthesis. V mnemonic is DPSS. D is diphtheria, P means Pseudomonas, S means Shigella, and then S means Shigella lactoxin, which is E. coli, right? So these four things are there which decrease, right? And then what do we have here is we can see the forms. Okay, so diphtheria can be in three forms: respiratory, cutaneous, and systemic. Respiratory, in this it will be like bull's neck, what we can see in respiratory. In this there will be enlarged, okay, lymph node. Then we can see cutaneous. In cutaneous we can see the ulcers. Then we can see the systematic one. In systematic we can have both CNS and PNS, right? Bull's neck is the most common one. Now let's see the microscopy. Whenever you will see the microscopy in this, what you will find? You will find letters, which is Chinese letter or cuneiform letters, right? In this it will be V or L shape. Either it will be V or it will be L shape, right? Then what you can see the granules. It will be like volutin granules, Babes Ernst granules, bipolar granules, okay, metachromatic granules, and polymetaphosphate for energy. So all these things you can see in diphtheria. Okay, then comes staining. In staining, what we can use? Toluidine blue, malachite green, and Albert stain, right? And also you can see other stains also. Okay, in other stains you can mnemonic is plain. So P is Pondus stain, L is Loeffler's stain, okay, A is Albert stain, and N is Neisseria. So which one is the best? So plain is there, so L is the best, which is the Loeffler's stain. Okay. Now there are some things which you can remember. For example, if you find anytime bamboo stick or boxcar, okay, that will be Bacillus anthrax. Okay, bamboo or boxcar, that will be anthrax. Whenever you find comma shape, comma means O is there, na? So let's take O and put it Vibrio. Okay, Vibrio. Then if it is cuneiform, okay, cuneiform means diphtheria. Okay, it will be directly diphtheria. In diphtheria you will have two mediums, LJ media, Loeffler syndrome. Okay, in LJ media it will be like TB, and you have Loeffler and LJ media, both that will lead to inspissation. Okay, otherwise all culture are autoclave. Okay, then you can have enriched media. Okay, in that it will be like 6 letters are there. Loeffler also has the 6 letter because it was the best. Enriched media, it will take 6 to 8 hours to grow. It is the one which is early diagnosis. So this was the enriched. If someone asks about selective, if you are selective, then what do you do is potassium toluate agar will be there, PTT. Okay, and the main thing is in this it will take 48 hours to grow. Okay, and this is the one which is the best media for Corynebacterium diphtheria. If someone asks about the selective media, okay, PTT. Okay, and if they ask about early diagnosis, then it will be enriched. If they are selective diagnosis, and in this if they ask best, then it will be selective media, PTT. If they ask the timing, enriched media, it was in this Loeffler it was 6 to 8 hours. In potassium PTT it will be 48 hours. Now we have two tests, a Shug test and Elect test. In Shug test it will be like spin, susceptible is positive, immune is negative. Okay, Shug test, and you have Elect test. In Elect test it will be like you have lines. If you have lines plus, then toxins will be there. If no lines, then no toxins. This is the Elect precipitation test. Okay, so this was all which I have told. Okay, now we can move further and we can see about in this we can see what is the like in Corynebacterium species. Okay, we can have like all we have flow charts we have here is, and in this we can see like ulcerans, pseudotuberculosis, and minimitose. So the most important is the minimitose first, or make you can know more also. In ulcerative means UL is there, U means ulcer, L means lung involvement. Pseudotuberculosis means S means Prasenocard bacillus, S means sheep. Minimitous, this is important. In this means minimitous means erythrasis means red rash will be there, where axilla anogenital or red rash will be there. So red, one more thing will be the coral red fluorescence, this will be there in the minute tissue. Okay, which is the non-lipophilic Corynebacterium species. Then it was a non-lipophilic. But if they ask about lipophilic, then you will have two things. This is also PYQ. In lipophilic, it will be what? Two things are there: JKM or urea lyticum. In JKM, it will be what? Prostatic valve endocarditis. JKM, prostatic valve endocarditis. And whenever it's urea lyticum, in urea it will be what? Stones, Stewart stones and proteus. Okay. In urea it will be Stewart stones and proteus. And whenever you will spore forming, in spore you will have bacillus and clostridium. In bacillus you will have two things: obligate and non-bulging. In clostridium you will have obligate but bulging. Okay, so all these things are there. In diphtheria, there is one conversion. Just remember, this will be lyogenic conversion. This question has come. Lyogenic conversion. Okay. Now let's talk about Bacillus anthrax. Okay. So in Bacillus anthrax, what do we need to know? First of all, Bacillus anthrax and Clostridium, they both are the one which are spore forming bacteria. Okay. So in spore forming bacteria, first thing is it is wool industry. In this, it will be in this there will be string of pearl. Two things are there, right? Okay, so now let's talk about more. This is polypeptide, which I told all will be there polycapsular, but here it will be polypeptide Bacillus anthrax. Okay, in this it will be anthrax toxin will be there. So in this it will be like English Premier League EPL. Okay, first of all it is tripartite. EPL means edema factor, protective factor, and lethal. Okay, edema factor it is a PYQ. Okay, so question they can ask all except tripartite is there, but EPL is there, but E will be edema, which will increase CMP. This you know. P also you can remember protective factor, but L is a lethal factor, not liable, right? So this was the thing. Now let's come to anthrax. What is anthrax? So we have three types of anthrax. Okay, it will be cutaneous, which is Hyde-Potter's trees. Then we have cutaneous. Second is pulmonary, and third is intestinal. So in the cutaneous, which is of skin, we can call this as Ishar black, right? There will be skin to skin coating, and there will be Ishar black. When it comes to pulmonary means pulmonary problem will be a wool shortage disease. So that means it will be bioterrorism. Okay, then it comes intestinal. Intestinal is uncooked meat, hemorrhagic enteritis, right? So these things are there. Then what do we have is anthrax. In anthrax, what we can see more in the diagnosis first we can see is we have a reaction called as M-Fard-Rier's reaction. So this is also a question which has come. And in anthrax, this Ishar black, this question has also come. So M-Fard's reaction, what is this? In this, it will be two things we will find: bamboo sticks and boxcar appearance. Okay, because it's bacillus, so B is there, so bamboo stick and boxcar appearance. Okay, and also in this there will be a head called Medusa head appearance, right? And then there is Bacillus cereus. So this question has come. So in Bacillus cereus, it will be like 8 to 16 hours, and also it contains of what? Fried rice, right? So I think rest all things I have told, like string of pearl appearance, okay, penicillin we can see, and also we can have a comet tail, beaten egg, frosted glass. This we can see. Okay, then we can see gelatin liquefaction. Okay, so now the main thing which we want to see is the gelatin stab. Okay, so for example, if they say tree is there which is inverted fir tree, that will be anthrax. Clear? If they remove the inverted, if they only say fir tree, fir means that then it will be tetany. Okay, tree tetany. Okay, if they say turnip, okay, or nepiform O means cholera, which is veg plus rice, right? So all these things we have seen. Okay, now in the treatment also we can give ciprofloxacin, doxycycline, all these things we can give. Now let's see about the spores. So whenever you have terminal spores, okay, then it will be what? You will have two things, either Clostridium tetani or tertium. Whenever it will be tetani means drumstick, or whenever it's tertium, TER is there, whenever it's R is there means R will also come. So then it will be like tennis racket, right? It's already TE, then it's drumstick. Whenever it's TER tertium, then it will be tennis racket. It was terminal spore. Whenever you have subterminal spores, that means the most common is Clostridium perfringens. Whenever you have central spores, then it will be bifurmingans, right? So these were the things. Now our Bacillus cereus. This question has also come, which I told 8 to 16 hours and fried rice. Okay, in this what you need to know is two things about Bacillus aureus. Sorry, in aureus and this cereus. This was the difference you must know. Incubation period will be less than 6 hours. Okay, now the main thing is in this there are two things: emetic type or diarrheal type. Emetic type and diarrheal type. Food. Okay, food will be what? In this emetic, whenever you are emitting, what you will emit? The thing which you have eaten. That means it will be Chinese fried rice. Okay, and this will increase what? Gala. Okay, so whenever you vomit something, so what you will vomit? First you have eaten something. For example, you have eaten Chinese fried rice. Now you will vomit out because it's emetic type. So whenever you will vomit out, so through what? Through mouth, it will you will vomit out. So that will be called as gala, right? So increase CGMP, that one is gala. Diarrheal means it will be 8 to 16 hours. It will be like meat and milk, and in this there will be increase was CAMP. So whenever you have diarrhea, okay, so it should go through anal side, so it will be CAMP, right? Okay, now comes what? Media. Okay, so we have covered what? Diphtheria we have covered, anthrax we have covered. Now let's talk about Clostridium. Okay, what is Clostridium? We have three types of Clostridium: Perfringens, Tetani, and Botulinum. Okay, these three things we must know. So in this, what we can start is, first we have is spore is subterminal. Okay, so in Tetani, tertium, this I told is, first of all, let's note Tetani means domestic. Okay, whenever you will have a tertium is tennis racket, central spores will be serious. Okay, now whenever, let's start about two things, either it's capsulated or non-capsulated, motile or non-motile. Okay, so most of the Clostridium species are non-encapsulated. Okay, they are not capsulated except PCB. Okay, P means Perfringens, C means Clostridium, and C means Butyricum. So means PCB is the one which is capsulated. Okay, or usually all are non-capsulated, PCB is the one which is capsulated. So in capsulated you have three things, which will be P Perfringens, B Butyrium, P Perfringens, C Clostridium, B Butyricum. Then comes motile. So all the Clostridium species are motile except PMT, right? Means P is Perfringens, okay, M means motile, okay, and then T means Tetani. Okay, so all Clostridium are motile except the two. So these two are there which are non-motile, right? So now let's talk about Perfringens. Okay, so first will be the Perfringens, then Tetani, then Botulinum. So in Perfringens, it is what? It will be gas gangrene, stormy fermentation. Okay, in this there will be pain, discharge, necrotic tissue, gas bubble, crepitus, all these things will be there. And what the treatment of gas gangrene? The treatment will be surgical debridement. Okay, we have to, by this question has come, so we have to remove it by surgery. Okay, then what else we can do? IV penicillin or clindamycin 10 to 14 days. Then what we can do is hyperbaric oxygen. All these things can be there. Okay, and clinical features what can we have is, we can have food poisoning, we can have history of trauma in Perfringens. Okay, and also we can have is necrotizing enteritis, cold and warm meat. Okay, then we can have pig bell disease. In pig bell means PPP will be there. So pig bell disease, pork, sweet potato. So we can have 4 P's. P is Perfringens, then second P is pig bell, then third P is pork, fourth P is sweet potato. Okay, then organism that cause gas gangrene. So in gas gangrene we can have PSN. Usually we study PSM, but here it will be PSN. N will, P means Perfringens, S means septicum. So in septicum there is citron body. Then comes N means novi. Okay, so these were the things. Now we have to study about diagnosis. So in diagnosis, what we can see here is, in diagnosis we can have Preeti Sharma Ping, for example. Okay, so Preeti Sharma means P is Perfringens, S means sacrolytic, okay, and third P is pink. Okay, so these are the this is how you can diagnose this. You can have a RCMB means Robertson cooked meat broth. Okay, Robertson cooked meat broth is there. Then you can have Preeti Sharma pink, Perfringens, sacrolytic, and pink. Okay, then what you can have is, a question can come like, whenever there is lactobacillus, so what kind of pH it will be? So that time it will be acidic pH. Whenever you will have complete tetanus, which is 7 years ago, you have completed tetanus. So what you will give now? You will give single dose of tetanus toxoid. So these are the two questions which have already come. Okay, and in this now let's come again to gas gangrene. Okay, so stormy clot will be there. So now we can have a litmus milk test, and this the mnemonic will be senior NTR. Senior means stormy clot formation. Okay, senior NTR. N is what? Nagel's reaction. Okay, T means target hemolysis. R means reverse chem test. Right. So this was all about the Perfringens one which I told. Now let's talk about tetany. Okay, tetany, in this it will be what? See, first of all there will be stiffness and painful muscle. There will be jerky movement, and in this there will be drumstick appearance. Okay, And also in this there will be inhibition of what, GABA glycine. Okay, so let's talk more about it. That in this there will be muscle spasm. Okay, tetanospasm will be there. This will be oxygen stable and lysine will be liable. Tetanospasm will be oxygen stable. Tetanolysine means there will be liable, oxygen liable, right? So first muscle to be affected will be what, masseter muscle. Okay, in this there will be log jaw or trismus, right? Now, what can we have here is we can have complications. Complication can be like rhesus sardonicus or ophthotonous position. So ophthotonous position, this is very common, and rhesus sardonicus, this is also very common in the titanium. Okay. Now there are two things which are to be understood. Okay, which is very common also, and which is also differentiating feature between the two, tetany and botulinum. See, tetany is the one which will cause what, muscle spasm, right? And its work will be what, its work will be contraction and acetylcholine formation, ACH, right? Two things will be there. And also in this there can be what, in this it can be, there can be striking poisoning which act as post synaptically. So this is the tetanus, right? And whenever you talk about the botulism, in botulism it will be what, in botulism it will be caned or booked. Okay, bottled, cane or bottle will be there in the botulism. This will cause what, botulism, this will relax the GABA glycine. Okay, so tetanus will not relax. Tetanus will do what, contraction and ACH. Botulism, cane or book, it will do what, it will relax GABA glycine. So these are the two things which you need to remember, right? And also in this there will be swarming, where in the tetanus. Now comes botulism. So botulism, I told, cane food, descending paralysis, these things will be there. And in this it will be what, the work will be relax GABA glycine. Okay, now types of botulism. In this there will be three: foodborne, infant, and other types. In foodborne it's what, caned food. So it will be what, it will be diplopia. All start with D: diplopia, dysphagia, dysarthria, descending flaccid paralysis, and dilated pupils. Now infant, whenever it's infant means first thing will be what, constipation, and infant means baby, so floppy baby syndrome. Okay, then other means surgery, right? So this was all about Clostridium botulinum. Okay, and also this in this there will be difficile, Clostridium difficile, that will cause what, that will cause pseudomembranous enterocolitis, PMEC, right? So we have done this. Now let's talk about filamentous one. So we have done both of the spore forming anthrus, Clostridium. Now let's talk about filamentous, which is gram positive. So in gram positive we have two things, nocardia and actinomyces. Okay, mycetes. So we need to know the difference between both of them. This is very important. Okay, so in this, first of all, what do we need to know is which one is aero, which one is non-aero. So there are two things which are only full opposite. Nocardia is aero, and this is 1% acid fast. At least this is 1% acid fast. Now when you talk about actinomycetes, in this it will be like, first of all, it's strict anaerobe. Okay, and it is non-acid fast, means NN, all no right now. Okay, now let's talk about in nocardia what it will be like. In nocardia what you can see is O2C, acid and soil. Means first of all in this there will be soil. Okay, and above soil what happens is the rain. Okay, then it will be acid. Then comes to C is what culture, which will be paraffin bait. Then we can have oxygen anaerobe. So the most common side is pulmonary, extrapulmonary will be brain, right? Let's talk about actinomycetes. This question has come. In actinomycetes it will be everything in the mouth, means endogenous flora. Most common site will be the jaw. Okay, then will be oral, cervical, actinomycosis triad. Okay, then you can have a molar tooth appearance on solid media. So this is all actinomycetes. Okay, then you have nocardia and exotomycetes. So in nocardia what we can remember is SN. SN means S is sulfonamide, or N will be nocardia, and here it will be AP, actinomyces and penicillin, SN and AP, right? Now comes a VQ. VQ has also come of nocardia. Okay, and in nocardia VQ we can see. So in this also what we can see here is the gram stain, okay, red color will be there, Zn staining, and it will be acid fast and branching. So this is question has come. In question you will find acid fast and branching, so that will be what nocardia. And when you talk about actinomycetes, which is AP, penicillin one, in this question has also come. In this, what you will see is, you will see sun ray appearance, okay, you will see splendor, hopefully, and third what you can see is sporothrix fungi. So these three things you will see. First is sun ray appearance, splendor, hopefully, and third will be sporothrix fungi, okay. So what you have is gram positive filamentous, you have sun ray, pink layer, splendor, pore, hopefully, actinomycetes, and sporothrix, okay. So these were all the things. Now let's talk about actinomyces Israeli, right? So in actinomyces only, we are going little more. So Israeli, so means two I are there, means IUCD and PD. Two things will be there. And actinomyces, what I told, all everything will be in the mouth. So mouth, tooth colonies will be there, and drug of choice will be the penicillin, right? PD is what? Pelvic, we can say pelvic inflammation disease. And IUCD, intrauterine contraceptive device, right? Now we have covered these two. Now what is left are three things: Listeria, Mycobacteria, and Cereus. Okay, in Listeria, what do we have is, see, Listeria means Tully. Okay, so in Tully we can have a B C D E F G, like this things we can see. And in this first, what we can see is Tully when happens at 35, and whenever you become non-Tully, then it will be no tumbling, means 37 degree. Okay, in this we can have a test. We have flagella, okay, for sure. And Listeria means food poisoning and low refrigerator temperature. So whenever you have Listeria, in this ABCDEF, A is Anton test, which is done in animals. B is beta hemolysis. C means spread, that will be contact contaminated cheese diary. All these things will be there. Then D is diarrhea. E is ELISA test. In ELISA, what do we have is catalase, chem positive, cold enrichment, which will be 4 degree. Okay, then we have E and F. In F, it will be females pregnancy, neonatal infection. G is granulomatosis, infectis septa. Okay, yeah. Now let's see the treatment. Treatment will be ampicillin and gentamicin, A plus G. Okay, in chem test, what do we have? We will have, in chem we will see two things: Listeria or A galacti in chem. And whenever you have reverse chem, then it will be C perfringens, right? So this we have talked. Now let's talk about mycobacteria. Okay, in mycobacteria means TB. Okay, so in TB means mycobacterium TB. First of all, what we have? Positive Zn staining. Okay, this question has come. Acid fast bacillus, which is due to what? Mycolic acid. This question has come. In this we can have cord factors. We can have LAM. Okay, in this LAM test, then this question has also come, where HIV in TB patient. This question has come. Most commonly it affects his lung, but question has come out second most common, that will be lymph node. Okay, so now you can see the foci, where it will be gone foci will be in the lung. Okay, gone complex will be there in lung and hilar lymph node. Okay, gone foci, gone complex, then where it will be Ranke complex will be in the lung, lymph node with calcification. When then you have Simon, Pol, and Esman. Simon is where? Simon is usually there in the SPA, Simon, Pullman, Esman. Simon is there at the apex, Pullman is there in the supraclavicular, and Esman in the infrascapular. So SPA, Simon, Pullman, Esman, apex, supraclavicular, infraclavicular. Then you have Simond, O2M is there. Simond means it will be liver. Veigut means vessels, and rich means brain. Brain is always rich, right? Then we can have in case of pulmonary TB, sample is taken is sputum. Then a question has already come, like concentration of it. Okay, so it's like first it will be like we can do it modify Petro method. How much concentration? 4% NaOH. But further, what we can do, this question come N-acetyl L-cysteine, which 2% NaOH, right? 2%. Don't forget this, right? Then we have Zn staining. In this, it will be like orange, red, and blue background. Okay, and it will be a VQ. And then we can see sensitivity 10:4. Okay, then in this it will be MTB is there, na? So aura mean and rhoda mean, no N. Okay, and then what we can see here is this is there, and then we can see the staining. It can be Lausen, Jensen medium. Okay, 6 to 8 weeks. And then we can see Melisite green, and then we need to see the difference between them. Tuberculosis and bovis. In tuberculosis, everything will be positive. Niacin, nitrate reduction, catalase, everything will be positive. In bovis, everything will be negative. Okay. And in colonies, when we see it will be rough, buff, and tough. Rough, buff, tough colonies in that tuberculosis, and bovis it will be smooth, white, like this. Then we have new methods. It will be Bactec method. Okay. In Bactec method, we can see fluorescent based method, and then we have Versa-Track, which tracks the pressure. Okay. Then we can see the typings, molecular typings. So the question has come in the molecular typing, and in this what we can see is RFPL. Okay, that will be like IS6110 strain. IFPL, RFLP, that will be IS6110 strain. Then we can see the gene expert. This question has come. It will be like CB naught. Time is around 2 hours. Okay, resistance to what? RPOB gene. It helps in diagnosis, and limitations is 131 organisms per ml, right? Then we have probe. Okay, in this also question has come. There are two tests, Montox and IGRA. This question has come. It's for what? It's only on whole blood sample, right? Then we can have a Montox test, which is type 4 hypersensitivity. Okay. And in this also, first there are three things. Extrapulmonary TB will be for the lymph node. Whenever you are XDR means you will have MDR plus fluoroquinine. XDR means MDR TB means rifampicin and isoniazid plus fluoroquinolone, that will be ofloxacin. Okay, plus one more thing will be there, what? Amikacin, that will be injectable second line drug. MDR, fluoroquinolone plus injectable second line drug. All these three things will be there. Whenever you are mother with TB, start ATT after delivery. Okay. Yeah. Now you can see interpretation. Okay, this is given intradermally, and then you can see IGRA. This is one of the favorite question, which I told also. It's usually only on whole blood sample. This is what? Interferon gamma release assay. The sample will be on where? T lymphocyte. This question has already come, and then you can see the non-tubercular mycobacteria. In this also you can see like what are the, which is light. So whenever it's photochromosome means light, it will be there in the light. Whenever scoto means light and dark. Non-photochromosome means no pigment. Rapid means 1 week or more, right? Okay, so this thing we have seen. And then we can see photochromogens, which are there in the light. You can see Merium means it will be there in swimming pool of fish tank granuloma. Okay, then you can see scotochromogens means light and dark. Okay, so God save dark. God means Gorodoni. Okay, save means you can see Scrophulgium and Shuluzai, right? Then you can see non-photochromogens. From this also question has come, which was of ulcerans means Bruley ulcer, right? So this question has come about non-ulcer in which there will be no pigment will be produced. Okay, and also we can see the important information in which we can see like the vaccine. Okay, so whenever you have Indus prani, okay, in prani means there will be immunomodulator, but whenever we have MW, that is for leprosy, right? And then we can see the rapid growers. Okay, we can have smart, fortunate, chalu, free, smart, smegit, stigmatis. Then we have fortuium. Then we have chinolei, then fillet. So in chinolei question has come, which is chalu. This is post surgery abscess. Now comes the very important lepra. This question has come. In this you can see red type animal. Okay, what you can see is this is a obligate intercellular. This cannot be grown on any other medium. And this is the line that is 9-branded armadillo or foot pad of mice. These two things will be there. Okay, in this it will be discolored, anesthetic skin, ulcers on the sole of the feet, and you can see loss of eyelash. Okay, so these three things you can find. Now some extra points about lepra cells or virtual cells. Leprosy, there will be what? Ulnar nerve. There can be lepromin test. Okay, this will be negative in children in less than 6 months of age. And the main thing is lepromin test is used to classify what? Leprosy, right? And there is also mid-soda reaction that will be in 3rd week or 21st day. So thank you guys. So we have completed bacteriology part 1 in as soon as less time. Thank you guys.